Good afternoon, everyone, and welcome to talk number 1 in our 4-part series, Back to School Midday Chats. Today, we're going to talk about ways that maybe you can prevent injuries in sports. My name's Ian Hurlburt. I'm an athletic trainer, and I work for Rochester Regional Health. I currently provide the medical coverage for the sports at Finger Lakes Community College. I've worked in a number of settings, the collegiate setting, the high school setting, the rehabilitation setting, and the strength and conditioning world.
My name's Melissa Wassink. I'm also an athletic trainer for Rochester Regional Health. I've been a certified athletic trainer in the high school setting for just over 5 years now, and I currently provide service to Waterloo High School and Marcus Whitman High School.
So Melissa, I think we get a lot of questions, about preventing injuries. And I think one of the biggest things that I tend to say to parents when they ask this, is they constantly ask, well, how do I keep from getting injured? How do I keep my kid from getting injured? And the biggest thing that I try to get them to understand is sometimes injuries aren't preventable. There's a lot of variables in sports that make it impossible to be completely risk-free from any injury. So what I like to educate them on is more in reducing the risk of injuries. The biggest thing and the biggest way that I find to help people reduce their risk of injuries is to do some work in the off season on maybe their movement quality. A lot is focused on movement quantity, and as we'll talk about later, a lot of high school quick kids get enough movement. The athletes, they're moving a lot, but maybe the quality of their movement is what needs to be worked on. Working kind of in the strength and conditioning setting, that was a lot of our focus. We did a lot of work on how people were moving, making sure they moved well, because they are moving a lot. If you put poor movement quality on top of a high quantity, that tends to compound, and over time, you can get a lot of overuse injuries. Again, some things that maybe we'll touch on later, but tendonitis, maybe some knee pain. That's not necessarily an acute injury or something that happened right away, but more something that's due to maybe they squat poorly, or maybe they pitch poorly, or maybe they do have some sort of faulty mechanic. One of the biggest things that I find is knowing who you're looking for, what kind of professional they're looking for. A lot of people, unfortunately, go in uneducated when they're looking for somebody to help them do this work in the off season. I think knowing credentialing is really big. Unfortunately, there are some non-credentialed personal trainers out there that maybe aren't the best for athletes. Maybe are working off of a weekend certification where the parent should be looking for something more like a certified strength and conditioning specialist, or somebody that has a certification in athletic training, or some sort of movement certification. So I think that's one of the biggest things that I find that athletes go and see. Have you seen this in the high schools, anything with your athletes?
Yeah, I definitely think one of the biggest things that you can do to prevent injuries, especially with us coming up to the start of all the fall sports and everything, is just really conditioning in the off season, like you said, and making sure that they're doing something over the summer so that they don't just show up to practice and all of a sudden it's a huge stress on your body. I think parents should really encourage their kids to make sure they're doing something that mimics the demands of their sport, whether it be going out and running, they need to do some sprints or some strength training. But yeah, also what you touched on, really making sure that they focus on their form in the off season and build up the strength, and then just that they're doing something coming into preseason so it's not all of a sudden a shock to their body.
Right. And I think another thing that a lot of parents say then is, well, my kids don't have an off season. They go from their baseball season or softball season right into summer baseball, right into fall ball, and then they work with a hitting coach or a pitching coach in the winter, and that's just one example. There's many other examples of athletes trying to juggle, multiple sports at the same time, or just a lot of, demands from club sports and their school sports. So, I was just curious if at the high school level you see a lot of kids that maybe specialize in one sport, and maybe how that could be detrimental or maybe beneficial. What do you see at the high school level?
Yeah, so the schools that I'm at now are a little bit smaller in size, so a lot of the kids tend to play multiple sports. But again, that becomes an issue where they're going right from one sport into another one, and they often play other travel sports in between, or also simultaneously with their school sport. So that kind of becomes an issue where they just don't really get the recovery time that they need. And then again, with the single sport athletes who kind of specialize all year round and just play that one sport for school and then also travel or whatever it may be for the rest of the year, they do tend to get a lot of the overuse injuries just because it's a lot of repetition with doing the same activity all year long. They don't really tend to get a lot of variety and that kind of well-roundedness that you would get from playing multiple other sports or going from an upper extremity sport to a lower extremity sport per each season. So yeah, the biggest thing I think is that they're just constantly on the go and they really don't get a lot of recovery time.
Now, do you know of any regulations or anything that maybe have been put in place recently that kind of try to keep these athletes from, having these overuse injuries?
Yeah, the biggest one that just came about last year was with baseball, where they're really trying to keep track of the pitch count, and they have to sign off after the game, and then depending on what their pitch count was, they have to have a certain number of days of rest from pitching. So
right.
That definitely kind of helps protect them from those type of injuries.
Right. And I know at the college level, I even get athletes here that play multiple sports here. They might play a fall sport and a spring sport. Some of our better athletes actually are the ones that tend to do that. I know, talking with a lot of college coaches, there's ones that will specifically look or target athletes that do multiple sports because they do worry about the overuse injuries. They worry about, maybe they're not a well-rounded athlete. Maybe they are too focused on one sport. I know a couple years ago, there was a big social media hype about Urban Meyer, and he came out and actually said, out of his 47 football recruits that he had, only 5 of them just played football. And I know, talking with coaches here and at other institutions, some of the coaches will even look for athletes that play multiple sports because they want to see them in that other sport. When they see them in what you would say is their main sport, the coaches are very focused on skill, how their skills are their skills developed. Some of them will go to maybe the sport that's not their main sport and look at the other intangible things. They'll look at their leadership qualities. Do their teammates look up to them? Do their teammates respond to them? Do they have kind of that will to win or that killer instinct? They can look at those other things as opposed to just looking at their skill and just recruiting on that, because they find that it is really important that they have these other qualities and that they can build, that they're a well-rounded person and kind of that they can build a program around them as opposed to just being good at that one sport. Obviously, overuse injuries is a huge concern when it comes to one sport. The big sport that comes to mind is baseball. But it happens in other sports too. I notice a lot of athletes that play soccer all year round. They tend to maybe suffer from, again, some of those tendinitises in their lower extremity, or maybe some imbalances because they just play soccer all year long. Soccer is an all-year sport. I think a lot of parents become concerned that their kid's going to fall behind if they don't play that one sport all year round. And I think from our perspective, that's a little bit of a misconception. Again, talking with coaches, they like athletes that play multiple sports. And I know from our perspective as medical professionals, we really like that perspective because the likelihood of them getting injured or getting those chronic injuries will be lessened because they become more well-rounded athletes. The next thing that I get asked as far as injury prevention is a lot about equipment. Is equipment good? Is equipment bad? What equipment can I get for my kid? Have you seen anything recently that maybe people can go out and look for, or maybe what they should be looking for when maybe it comes to getting any sort of protective equipment in sports?
Yeah, I think just as a basis, parents should make sure that they're getting good quality equipment for the kids, whatever's required for their sport, whether it be shin guards for soccer or shoulder pads and helmets for football. Make sure that it's a good quality and everything fits well. Those requirements are there for a reason, obviously, to keep them safe. The other one that came about recently is they are now making helmets for girls lacrosse. That's not something that's mandatory yet, but I did see quite a few girls wearing them last season, so that's a new improvement I think that's been made and will help keep them safer.
Yeah, and I know they're constantly making improvements to football helmets. They constantly have new helmets that come out, and they have specific grading criteria that grades the helmets. I know hockey specifically is maybe one that maybe fell behind a little bit, and I know they're working their way back up to kind of get on the same level as football helmets. Lacrosse helmets for men's lacrosse, the exact same. Maybe they were a little bit behind where football was, but they're coming right back up. The other thing that I've seen sometimes, and I even have a couple athletes and parents that have asked me about it before, is the helmets or the headbands for soccer. Maybe something that needs a little bit more research done, but it is something that's out there. It is something that I've seen. I've had experience. I had an athlete that wore a rugby cap for soccer because kind of he had some issues with it. So I think there's a lot of opportunities and options out there. I think it's becoming an informed consumer with anything else. Doing research, doing your due diligence to know, am I buying what's best for my kid? Looking outside of just the company to see where they're at as far as rating, and looking for an outside source to kind of confirm, yes, this is a good equipment, or maybe this is a not so good and it's being a little bit hyped by the company. So that's what I always tell my parents, is to make sure that you're looking for something, and that you're doing the reviews, and you're asking around, you're asking more than one professional about it, and making sure it's the best thing. Here at the college level, we get kind of a full disclosure of athletes' medical conditions. They have to fill out a questionnaire. We ask all sorts of medical questions for the athlete. We also ask the same questions if they have a family history. We ask specific questions about trouble breathing, issues with heat. We even ask about orthopedic injuries, so we can kind of get a history of maybe injuries they've had in the past, things that we can be on the lookout for, maybe some red flags of things that we may want to just keep an eye on, or have some follow-up with. I know when I worked at the high school level, it wasn't always so nice. We didn't always get that information all packaged that way. What are your experiences as far as at the high school level, and maybe what should parents disclose, or what should they look to tell their athletic trainers?
Yeah, so I don't usually get the full medical history that they've filled out, but I am aware of certain conditions like asthma, or if anybody's carrying an EpiPen for something like these things, or other than that I would need to be aware of during a competition. But athletic trainers should make sure that parents should make sure that they disclose with their athletic trainers any specific pre-existing conditions that their athlete may have that might be an issue during sports.
Right. And I know here and at other high schools and places I've worked at, the obvious ones are always made aware. It's some of the maybe less obvious ones. Does the athlete have an inhaler that needs it? Do they have their EpiPen on them? Have they had some sort of minor heart condition that bothered them maybe a few years ago, but they haven't had issues with it? I have current athletes that kind of the same thing. I'm already have that information, but if I didn't have them fill out the forms, I may have no clue that my athlete was having some chest pains, and a few years ago he had a whole cardiac workup, and maybe it has nothing to do with that, but in some cases maybe it does, and maybe you need to be a little bit more cautious with those kinds of athletes. So I think just making sure that at all levels those things are disclosed, I think, are really important. So I think that'll wrap up our talk for today. As always, leave questions or comments on this video. We would love to hear from you. We would love to answer any specific questions that you may have. You can also reach us at rochesterregionalhealth.org/sportsmedicine. It was a pleasure talking with everyone today. It was a pleasure talking with you, Melissa. And hopefully we'll hear from some people out there, and we were able to kind of give them some insight as athletic trainers of what we like to see, what we like to hear, and maybe what parents can go look for.